information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome, everybody. Dr. Tom Roselle here. Welcome to another episode of Ageless Health, and one that's a very special episode for me because, one, it's part of the background that I've had for over 4 decades of clinical practice. But more importantly, anytime you get to interview people who are really at the top of their game and a shaker and mover, people who are making things happen and expanding the format of what we do, and particularly in natural integrative therapeutics, it's always fun. And that's what we're going to do today. We'll tell you more about that in a second. Want to remind you that follow me on all the social media sites. So when we do these programs, that you'll be immediately notified that they're there, because they're here for information-based reasons. We want you to have all the tools that you can to optimize your health and wellness and to take control of it. That was my book years ago, Ageless Health. Health is a do-it-yourself program, which, by the way, is still available. You can find it on Amazon, I think, or just go to agelesshealthbook.com, and we'll figure that out and send it to you. So I think it's Ageless Health Store. Being prompted to tell you the truth, so you can go there and you can find it. So sitting there in front of the screen, you can snap that and go there and have fun with it. I've got another one coming out this year, and it's an upgrade of this plus one more, so you'll have some fun with that. So let me tell you about what today's program is really all about. It's kind of the merger of Eastern and Western medicine. We're going to talk about traditional Chinese medicine and how it works in my world. As many of you know, diagnostic muscle testing, integrative therapeutics, also known as applied kinesiology, not just kinesiology, but applied kinesiology. And because we look at everything from a triad of health, we look at things from the neurological platforms and body, we look at the biochemistry, bioelectrical system, and we look at the mind and the emotional, and even at the spiritual level, if you want to take a look at that way. And they affect systems like the brain, spinal cord, the nervous system. They affect the elimination of waste through the lymphatic system and blood supply through the Bennett reflex systems of the body, and then spinal fluid function. But the piece we're going to look at today and how all that goes hand in glove is the acupuncture system. And that's your energy platform. And to talk about that, I have to have somebody who's really special. And I'd like to introduce you to a very dear friend, Haley Parker. She's the director of clinical operations, actually in the Washington metropolitan area at the Virginia University of Integrative Medicine. And I have tremendous admiration for her, but also for the school. The CEO of the school also has become a good friend, John Yu. These people are really trying to put together very talented practitioners and people who understand herbal medicine, people who understand acupuncture. Dr. Parker has a huge background relative to education and what she's been exposed to. She's worked with other companies and really trained and explored the capacity of merger of different areas. But we're going to talk about that, and you're going to find her credentials are going to be in front of you there as we go through the program. So I don't want to waste a lot of time, going through, because if I sat here and I went through and bullet point her credentials, we'd be here for another hour, because she's that talented, she's that amazing. Having said that, Dr. Haley Parker, welcome to Ageless Health Podcast.
Thank you so much for having me. Equally as honored to be here with you today.
This is a fun program. This is where I get to dig, and it's outside in addition to all the things that we do on a regular basis. Let's start with a really basic question. You are the director of clinical operations at the Universities of Integrative Medicine, Virginia University of Integrative Medicine. That's a mouthful. I got to get it together and make sure that I offer it up the right way for you. What does that mean? First, tell me what the school is about fundamentally, and what is the objective, the goals? Because our listeners want to know what their options are. They want to know do I just do one piece and let everything else slide and to optimize that? But tell us a little bit about the school's background and what the concepts and the mission statement is and so forth.
Sure. So yes, it is a mouthful. In fact, when I took this position with VUIM, what we call for short, it was like, oh yes, I'm the new director of clinical operations at Virginia University of Integrative Medicine. And I would kind of sit there and be like, I just would rather talk about them. So Virginia University of Integrative Medicine is an integrative medical university up here in Tysons Corner, Virginia. We also have a branch in Ridgefield, New Jersey, and one down in Duluth, Georgia, right outside of the Atlanta area. And our mission is to operate in that whole person health model. Our mission is to teach students of the future who will be future acupuncturists how to interact with other medical practitioners and work together in helping our patients receive all of the different spokes to the holistic wheel. So as we know, being acupuncturists ourselves, acupuncture has been around for thousands and thousands of years, and it's wonderful at preventing illness and also helping to treat the root causes of disease. But we're so blessed to live in a modern society where we have immediate medical interventions, and using Western medicine and Eastern medicine together, we can really give our patients the best care and be able to tailor treatment plans to their individualized needs. So with a big premise of Chinese medicine is that we're looking at that person and we're digging into the etiology of what's caused their conditions, as well as taking in individualized factors like their stress levels, their dietary components, their environmental factors, their emotional history, as well as like their physical presentations to put together a personalized treatment plan. So our university is a 4-year program where our students come in from whatever background, whether it's Western medical background, a second career type background, or right out of school, and they're able to develop these skills and learn this different language of understanding what the body's saying and how that applies to the Western medical jargon and world that we live in, to better have those communications and conversations with not only medical professionals, but also the patients so they can better understand their body.
Haley, as I said, my exposure has been significant as far as my influence relative to how I practice and what I do. And I've had an interest in acupuncture before I even started professional school. And then I ended up getting my certifications and my degrees and my license in acupuncture and so forth. But what I was really amazed and what drew me to it was preventive care, which I want to get into a little bit with you. And simply because the fact that, you go back thousands of years with acupuncture, and the court physician, or the emperor's physician, if you will, was there not just to get them out of trouble when they were sick, but their primary reason that they existed was to keep them well. And if the emperor got sick or the family got sick, the court doctor or the emperor's doctor failed, and often they paid with their life because of that. So that's why when we're looking at energetic balance, if you will, the capacity of the body to work in harmony, to able to signal in a normal way the heart with the lungs, the intestinal tract with digestive function, and so forth. It's not just the organ system itself that you have to look at, it's the flow of energetics. And we know that, for example, that in the interpretation of acupuncture in this country is not really what it was in China. I have a doctor that works in our center who was trained in China. He worked in the hospitals in Shanghai and so forth. And so when he first came in to see us, we started talking about, the channels, if you will, meridians back in the day. And the channels and the meridians are named for the acupuncture organ systems, or that they flow through, are the ones that they control. And I would say, well, lung, and I would give him a point, lung 7. I would give him a kidney 4 or whatever. And he would look at me very strangely. And he says, what do you mean? So I would take a chart out and I would point to it. And he says, oh, and then he would give me a name for it. So the names that they ascribed to the different points had very specific meanings relative to what their application or how they affected the body and so forth. And that was something that I didn't know until I met him. And that was kind of curious. In your school, is that the focus, or do you go more Western?
So it's a little bit of a mix, because we tend to be the bridge between what the traditional Chinese medical system was communicating and the language that the students are now learning, and how that is relevant in the modern times and with the conditions that we see coming in. So 5,000 years ago, when the Chinese discovered this medicine, they didn't have x-rays or microscopes to know about the nervous system or the circulatory system. They didn't have the understanding of what the endocrine system and the receptors were that were communicating these chemical messages through the brain and the body. So in traditional times, they understood concepts like qi, yin, and yang, and these interplays and relative balance of these different fluids in the system. And now when we get into modern times, we're able to break down the endocrine system or the blood profiles and understand what that person's chemistry is saying. And so when the students are learning this, a big part of what we do here at our school is that we want them to understand the traditional way. But if they can't communicate, their communication's only as good as their receiver's comprehension. And so being able to bridge that over into how to discuss what they're finding in their practice of a traditional therapy to a medical practitioner who can then better create a collaborative care plan to improve that patient's health.
So hey, let me ask you a question before you get into it, because this is something that there's a lot of misinformation relative to the application of acupuncture, particularly, and this is where I was going to kind of lead into, in this country. In traditional Chinese medicine, you're balancing energetics. And so if the harmony of the body energetically is working the way it's supposed to, then the body is self-restoring, if you will, right? So, for example, I had a patient the other day that came in and had AFib from this crazy COVID vaccine that was affecting the heart, it was affecting the small intestine. Well, they're yin yang to each other, the heart being yin, life-giving, if you will, the small intestine being externally, relieving. We'll leave it that way for our Western listeners. But the question becomes, I put a needle in heart 7 and pericardium 6, and then I used an ear point, but then I needled the intestinal tract as well. And within the time that I had the person in the office, all of a sudden it was gone. So my question is this. In Western medicine, with guys being qualified, if you will, medical physician, they take a couple hundred hours, chiropractors take a couple hundred hours, and they supposedly can do acupuncture. But they're treating symptoms, in my opinion, and they're not treating the body the way acupuncture was designed to be applied. How does the school look at that? Are you teaching a systemic approach, or are you teaching, if you got this headache, these are the points, large intestine 4, whatever, right? What happens?
So there are definitely learning curves for new students. And it takes them a while to understand that the brilliance behind traditional Chinese medicine is not just to treat the symptomology and the main complaints of the patients who are presenting, but actually go further into why is this concern happening. Yeah. And we see oftentimes in our clinics, we'll have 4 or 5 patients coming in with the main complaint of a headache. But then if we dig into where is that headache coming from and why is it occurring, each of those patients have a different etiology. And the traditional Chinese therapist is going into helping rebalance the cause of it and take care of the branch or the main concern. So the Chinese medicine, as you're talking about, is really about preventing it, but preventing it from the root, or preventing it from where those balances of the heart and the small intestine, or the yin and the yang, are glitching, and the body isn't able to interpret it. And oftentimes when we're trying to teach our students, we're saying to them, hey, the body doesn't speak English. It doesn't speak Chinese. It doesn't speak Spanish. It doesn't speak Pig Latin, right? It speaks symptom. And in Western medicine, we often have this feeling of, oh, our body's revolting. Bad body, right? Like, oh, you're giving me a headache. I don't have time for this headache. I got to go to work. And instead, asking a deeper question of, where is this headache coming from? Thank you, body. Thank you for giving me the signal that something's not right so that I can pay attention to it. Because oftentimes, if you don't listen to the body whispering, then that body's going to start screaming, and it's going to get louder and louder and louder. And what we then find as cases present and progress is that patients who've had something that was a little, irritating, like pain, right, down the line 60 years from now turns into, say, completely arthritic joints or frozen shoulders and migraine headaches that just take a lot more time to unravel and reestablish that homeostasis or that equilibrium where the body's designed to heal itself exponentially better than anything that we can do as far as intervention in Western medicine or Eastern medicine. Really, like, the body's designed to heal itself.
So, in my world, obviously, we look at the why behind everything, structural, chemical, emotional platforms, and not just, the guy went out and, he did something he's usually able to do, but all of a sudden now he's got leg pain. Where did that come from? And if you don't understand the why behind it, you're basically saying, here's 2 aspirin, call me in the morning. That's the type of philosophy that, unfortunately, that is imbued in our culture, and today even more so than it's been for years that I've been in practice. So when you have that kaleidoscope of intimacy that the body really expresses, if you will, and you're having to fight, the television commercials and the training, or I should say the manipulation that current allopathic medicine tries to imbue upon the population to think in symptoms, take this for that type of situation. How do you train your students, your doctors, your clinicians, as they begin to launch into the world, to understand that, one, as you said earlier, that they have to be able to teach the terminology so people can understand it, that they need to also become the physician means teacher, right? Educator. How do you train them to walk out the door and be able to evoke confidence in the patient, but also give the patient an understanding of what it is they really have to do?
I yell at them a lot to try to get that point across.
Got it.
So you're correct. The original meaning of doctor is teacher. And if you look back to the Hippocratic Oath, where really Western medicine, stemmed from that Greco-Roman model of like isolating variables and scientific evidence. But if you go back to the father of medicine, he first said, you need to teach your patients and then do no harm and try to help them live a lifestyle where they are better doctors of themselves. And so essentially, I teach my students that if they are not teaching the patient what their body's saying or how they can better prevent this like really big alarm like sign of the body saying, hey, I really need help, and it's caused them to come in and get needles put into them, then the practitioner is really not doing their job, because they didn't sign up to be someone who uses a scalpel or prescribes pharmaceutical drugs. They signed up in a heart space medicine of teaching a person and giving that gift of total healing, not just the body, but also the mental, emotional, and spiritual healing, which, going back to your previous question about Chinese medicine, they already understood that you're more than just the physical. You're a spiritual being in a physical form. And with that, a lot of Chinese medical practitioners really have to get into the nitty gritty of the mind and how that person is interpreting their pain. And so you're really pulling back these layers. And so it's never just a straight shot of, oh, come in once, or, oh, we're going to give you this and you're fixed. It's, let's try to teach you what's going on and what your body's saying. Let's peel back that emotional attachment. Let's peel back the way that you're engaging with your environment and causing so much extra stress to really help that person be able to navigate and better maintain their lifestyle. Clearly, we all are human, right? And we have habits, and we tend to then have aggravating lifestyle factors in our modern world, everything from texting to sitting at a desk to driving. And so over time, or, I think of my patients like my golf players, right? To them, quality of life includes golfing. So you're not going to remove that X variable from the algebraic equation, but what can we do, like adding in an acupuncture treatment or teaching them the importance of stretching, telling them to go and see their chiropractor so that they can better do the things they need to do and want to do while still keeping their body happy, and being able to live the life that they want to while preventing the injury from getting worse. So unfortunately, Chinese medicine goes to that next place that is not quantifiable, and it's really hard to isolate these subjective feelings of the person who's coming in with this urgency to take care of their pain, and then having to really teach them where that pain's coming from and also how they can be better responsible for keeping their body in check. Did that answer your question?
Yeah, I could sit here and talk to you about that particular aspect forever, but I want to complicate it for our listeners. But here's another direct situation. I'll go back to what I said earlier, way too much influence from Western culture on the application of natural remedies and natural medicine, whether it's acupuncture, whether it's herbal medicine, whether it's dietary patterns, exercise, and so forth. We get to a place where it's all or none. And that's not the way things were meant to be. Things were supposed to be in balance, and that's what energy. I spent years practicing Tai Chi Chuan, which is, as you know, is an energetic form of martial arts, and the whole purpose of that is balance. When in each culture, if you will, has different pieces of the puzzle, but they line up very similarly. So, for example, in Chinese medicine, and there's that's offshoots, we talk about the 5-element theory, right? And each system of the body, each exposure, each environment is ascribed to different things like wood and water and metal and so forth. In Indian medicine from India, there's 3 elements: water, fire, wind. But the essence of its application is very similar, because in every element there's the aspect of every other element. Now I don't want to get too complicated for our audience, but what I'm trying to get them to understand is that it's not as simple as identifying one element and say that's what it's all about. And then the understanding is, with our patients, at our office, what we end up doing is we try to teach them why they're worse at certain times of the day. And as you know, and I know that you teach at the school, is that each channel has a peak of energetic flow. So, for example, somebody gets really sick with a cold or pneumonia and so forth. Generally, their symptoms are far worse as they get closer to nighttime, and particularly the middle of the night. They're hacking all night long, they're coughing, they can't sleep. It's because the energetic platform for the respiratory system, the lung, if you will, is after midnight going towards the early morning, 3 to 5 o'clock, as we know. So when you try to begin to explain that, so let's talk about the emotional platform a little bit. In understanding the body, the organ systems, the intestinal tract, the heart, the lungs, and so forth and so on, we understand that each one of them has an emotional something that's related to it. For example, in crossover to Western medicine and observations, there was a diagnosis in Western medicine years ago that was called a dry drunk. And what that meant was this guy who hadn't had a drink, and we can even relate it to drugs today, somebody who's hooked on different drugs. Now they don't have them for 2-3 days. They get angry. They're ready to destroy things. They have to have that fix. That has to do with anger, liver function. So they correlate. But in Western medicine, they don't get it. In your world, you do. Talk us through that just a little bit.
Sure. So, oftentimes, like, when you hear someone else give you a cliche, it's annoying because you're like, it seems so superficial. But when you really start to think about what these things mean, you open up this huge box, like, of so many interrelationships. And that's really what Chinese medicine is. It seems so simple on the surface, and yet as you get into what the tradition was really talking about in the classics, there's so much wisdom and so much more that you observe. with that, you're discussing the list of correspondence. And so in Chinese medicine, everything is relative, or it's all about relationships. Certain constitutional energies operate at such a high frequency, while others are a little bit more methodical, and they work in a little bit more of that that swing set under a deck on a summer morning, right? Like it's a very different resonant frequency. But with that, it's the relative energy between the organ systems and how that person then is modulating the energy through them. So when the Chinese discovered this medicine, they already mapped this out, and they already observed that the internal environment maps on the external environment. So through processing of emotion, they could identify that there was something going on with the liver organ system or the heart organ system. Taking it further, there were different sounds, there were different smells, different times of day, different seasons. And over thousands of years of observation, they were able to articulate this in a very like mathematical way of identifying, oh, a person has these symptoms and it's correlating to this pattern. So pattern recognition, but through pattern recognition, identifying relationships and taking into context that individual, and taking into context of that individual, their relative relationship to these different aspects.
Got it. So here, I want to go back and differentiate some of the things that people think that are acupuncture and is being purported by the practitioners to be the acupuncture approach for pain patterns, and particularly neuromuscular, neuroskeletal. So what am I talking about? The question I'm going to ask you is this: is dry needling acupuncture?
Oh, that's a good topic. It is a type of acupuncture. It is taking a needle and it is putting it into aspects of the body. And as we know that when you put a little needle into the body, it is creating an instantaneous chemical change in both the brain and the body, right, which are all things that acupuncture does. Now, dry needling is coming from the Western approach, musculoskeletal approach, anatomical positioning, and they use acupuncture channels, and now, because of convenience, acupuncture needles. With that, it is very much a systematic, symptomatic approach to, say, trigger points or musculoskeletal glitches that the body wasn't able to fix the first time. Chinese medicine goes that next level deeper of going into why were those glitches occurring? Why were those muscles not balancing out like in their yin and yang patterns? Where was that blood chemistry that was not being able to adapt to the stressors that person was under to then go on to create this musculoskeletal pattern? There is a lot that goes on legally with the idea of dry needling versus acupuncture. And really, I am that optimist out there that thinks, hey, there are enough sick people, that there are enough people in pain, right? That needling is such a brilliant form of intervention that take people away from pharmaceutical drugs, that prevent.
Okay, so I'm going to make this real easy for you and for everybody else. My opinion, dry needling is not acupuncture. What it's designed to do is break up trigger points, acid formations that are trapped within ligaments, and tendons formations. That's all it is. And to anybody say that it's anything else but that really doesn't understand the difference in the platforms. And I know you're being very kind and you're being very guarded. I don't have to be. So what I want to let people know is, it does dry needling help? Yes, it does in certain situations. It can be very effective. But the other piece is, when you have a practitioner that has had no background in acupuncture or needling or anything else, and they take a weekend course or a 3-4 day course, and now they go in and they start doing dry needling, it pushes me into a different direction of, well, I'm going to be very kind on the program today because we have thousands of people listening to this, but it is not acupuncture. It is used, in my opinion, in ways that it shouldn't be used. The different trigger points can be injected with lidocaine, which seems to break up the vicious cycle within that is causing that irritation to occur. Acupuncture is going to balance the energetics. Again, you're very kind. You have to direct the school. I don't. So that's my opinion.
There are always politics, Dr. Roselle. As far as you're correct, and this is a very hot topic in the world of acupuncture, because we go to school for 4 years and we go on to take board exams, and we're licensed nationally and in our states by the State Board of Medicine. And there is a level of insult when we go through this extensive study to be able to use the needling modality as a medical intervention. And then other medical practitioners can go in for a very modified, abbreviated course without the dexterity gained through years of practice to go on to insert needles. And then there's a lot of miscommunication and misnomer. I'm like, oh, we're putting acupuncture in, and what's the difference between acupuncture and dry needling? And then we know how rumors spread and misinformation is created. So that does hurt my heart. And with that, the musculoskeletal approach can be done in acupuncture. In fact, we had points labeled a long time ago called Asher points, or these trigger points. And because of the efficiency and how holistic Chinese medicine was, practitioners who employ dry needling as a modality, in fact, use the acupuncture channels as a map, because there's really never been any sort of consensus on where a trigger point can be located. And the Chinese knew thousands of years ago where they could best identify these anatomical landmarks and these trigger points. So it's affirmation to the brilliance of Chinese medicine and how in depth they understood the functioning of the body, despite not having the cells or the clinical evidence for what was going on in an isolated experiment. So Chinese medicine is very much the breadth of the needling modality within these different nuances of how it can be practiced in our medical world.
Well, there's, in Chinese medicine, sometimes you bleed a point, and it's because you're drawing the energetic off of it, and it's used with a trapezoid needle. That's the piece that they're using with this dry needling, and they're making this big deal out of it. The problem is when you get these practitioners, again, my opinion, that have limited experience and really haven't had clinical oversight and what they're doing. Do they understand it, or is it a cookbook application because they're told that it works? Now, I won't get into the fields, whether it's people in my world or in other worlds that are using it. We use it in a traditional format. We don't use it as just a standalone technique, but we embrace the concept of acupuncture and what it needs to be. Okay, what I want to get into a little bit while we have time is I want to talk about what the term TCM, or traditional Chinese medicine, the concept of it really is. It's not just putting a needle in. That's acupuncture is not just needling. Acupuncture points can be stimulated in many different ways, but the application of acupuncture within, I'm putting it that way so our listeners can really get where I'm going with this, within the realm of TCM. What is TCM? And I know that's what you teach them.
Yes. So now we're back into my arena here. So Chinese medicine, acupuncture is one modality within the total compendium of traditional Chinese medicine. And there are different branches within that. So everything from herbal medicine, nutrition, body work, and then also meditative type practices or rightful thinking. And something that I found very interesting as I was diving into this medicine, because we're all newbies at some point in time, was I was approaching it as a Westerner myself, and you have a problem, give me an answer. And as you go into what is traditional Chinese medicine, you employ different branches for different conditions or different types of constitutions, seasons, different people's preferences. So, and because right there again, you can tell someone to do something if they're not going to do it. You're only going to get that far in their healing progress. So with that, rightful thinking is a big one. And that's then going back to our previous conversation about education, helping that patient to understand these different aspects of the total practice of Chinese medicine, not just a physical puncturing of the skin, but also then having the nutrients through nutritional counseling, having the herbal formulas through helping internally balance out the systems, and giving the building blocks of the body to then do something with that needle stimuli.
The interesting thing too is that, as my original degree obviously is chiropractic, but in Chinese medicine, performed properly, manipulative modes have always been part of that TCM platform, and you call it Twin Eye. Uh, when I was in China and I walked into the clinics and I saw some of these acupuncture practitioners and they were doing structural work as well. I said, oh my God, people who had hot discs, they had them on the table and they were doing structural adjusting that I had never seen before, but with effect and result that was mind blowing. And I said, "Oh my gosh!" I said, "If I did some of those things here in this country, I'd probably get arrested." But the end piece was that these people are getting off the table, they're smiling, the pain is gone, they were doing well with diagnosed ruptured discs and so forth. It was really incredible. It was very, very heartwarming to see where my roots, if you will, the things that I've embraced in my entire career started, and it really started in the East.
That's awesome. And you know what? That's where I really appreciate working with other practitioners. I worked with chiropractors from the time I began my practice. And understanding that all of us have something to contribute. I find it interesting that a lot of the time patients will come in and they'll think it's either or. They'll think it's Western medicine or Eastern medicine. They'll think it's chiropractor or massage, And in actuality, if you're really practicing holistic healthcare, it's all of them. And you got to use the right tool for the job. I grew up with brothers. I grew up with a can-do kind of dad. And he had, like 40 screwdrivers in his toolkit. Right. And for me, I have the basic like IKEA version, but if he needed something done, it would be so much more efficient if done with the right tool. And ultimately practitioners who start to begin their journey down becoming a practitioner, right? They start to add in different tools to their toolkit to best serve their patients. And over time, even ourselves, we begin to recognize patterns and we'll be able to refer out. And one of my best mentors always taught me, you become a much better doctor when you know where your scope stops and where you can refer your patient, because that patient gets better and that patient trusts you more and that patient knows you know what you're talking about. But also you've then learned to navigate your mastery of the medicine and where other practitioners can work. So for a lot of our students here in the school, they do come into school with other medical license. They maybe are chiropractors that were inspired by a Chinese medical conversion moment, or a massage therapist, or they have some other medical background, and it already really makes sense innately to them of how the structural system and the energetic system overlay. Other practitioners then begin to get exposure to other medical practitioners and being able to have these conversations of seeing where their medicine can help augment, say, a chiropractic patient, or where their patient can then benefit from the modality of massage therapy and be able to better develop their clinical style and what works best for the kind of patients they'd like to see to better refer out in the future. And in Virginia University of Integrative Medicine, that is a really big thing that John, our CEO, wants to help our patients, our students have, so that when they do go out and they fledge the nest, that they already are familiar with having to have these conversations, co-treating patients and being able to better be ambassadors to traditional Chinese medicine and all of the layers that it provides for our medical system here in the West.
It's so important that people really understand how the body works, and that it's not just one piece that you isolate. You have to really appreciate how the body works, and the overlapping understanding of what the systems are really trying to express. We know that gout, for example, just for our listeners to understand a little bit more of it, affects the big toe traditionally in the world of allopathic medicine, but they don't ask the question why. They just said, well, if you look it up and you Google it, use Dr. Google, they're going to say, well, that's where it is, the knee is second. Then if it gets really bad, you could get spinal problems and so forth. But the reason it goes there, if you go to Eastern medicine and really understanding, as you know, obviously, I'm not telling you anything you could tell me better than I can tell anybody, is that the beginning point of the liver acupuncture channel is on the big toe. And so we call it stagnation, if you will. It backs up. The liver's not working the way it's supposed to. So the energetic supply is not going to do what it needs to do. And I'll explain it to patients this way. If you have a car that's timing is off, none of the systems in the body, that car, if you will, are going to work properly. And there are going to be backed up systems that are now going to have to take the burden, and then they begin to break down. In Chinese medicine, you take something like that and you have the liver. How about if somebody's just generally an angry human being? It's going to affect the liver. If they're a drinker, they're exposed to chemistries. They have those types of ongoing day-to-day situation. In my family, there's somebody that I can lovingly point to that drank too much and was exposed to all kinds of fumes on an ongoing basis, and didn't really take care of the way they were supposed to take care. And not only we knew she had a fatty liver, but she also had gout, and the uric acid buildup because of the gout and so forth. And it was because of lifestyle that brought her to that place. And you could see her in situations where you can push a button, she get angry as anyways you've ever seen, very quickly, very rapidly. But then you would look at the whole processing that took place, and people understand that many headaches, if you will, as you know, are a result of liver stagnation, congestion, inflammation. And people say, why are you needling my feet? You want to pull the energetic away from that platform so the inflammatory level goes down. As you treat everything else, obviously you have to go. I'm making it very simplistic at this point.
Right. Well, so you brought up so many great points right there. And we often get mad at the gout, right? We often get mad at our toe that just malfunctioned. And it's like, no, that's exactly how the body's supposed to work, right? And going back to that whisper versus screaming, there were probably precipitating signs before, you had the gout flare up. But if the person doesn't make those interventions as that imbalance is coming in to inhabit their body, then the body's going to find more clever ways to get your attention. And like you said, with the organ systems, and going back to the list of correspondence, you're going to identify these patterns. And so as traditional Chinese medical therapists, we identify these patterns, we identify these emotions, and we see these clues to triangulate where the person's body is out of whack. And then, like a prescription or a recipe, we pick points that are going to help recalibrate that. So sometimes those points are not localized, right? Sometimes we're not going to put a needle in the head just because you have a headache. We'll go to another point along the body based on channel theory. Or we'll stimulate a point that's going to be helping balance out another recipe. And really, if we get down into it, thanks to modern technology and understanding of the brilliance of this medicine, it's really affecting the central nervous system and how the brain maps in the different lobes and stimulates that same area to say, hey, there's an issue down in the foot. We need to go down there and fix it. Or there's an issue in the liver. We need to remap there. And that communication network that is going through like the nervous system, it's going through the endocrine system, it's going through the circulatory system, it's recalibrating all the imbalances of the interrelationships of the cells. That's helping to recalibrate to give the body that fighting chance of regenerating healing cycle. And so there again, not just treating the symptom, not just treating the gout, but also addressing the underlying root of why that is occurring. And then through the lifestyle modifications like diet and nutrition and stretching and, probably rectifying some of that anger, the person can get ahead of their problem and move down the spectrum into preventative care.
Haley, this is so much fun. I could sit here and talk to you all day about this because obviously I love the topic and I love the application of it, but I appreciate it. I appreciate your time, and we got to do this again. And
I'd love to. I would love to.
We'll take it apart, but thank you. Thank you very, very much. You're very articulate and passionate about what you do. And that's what I want for our listeners, that they get it, that they understand that there's so many different opportunities for them to get well. And the application of Eastern and Western medicine done the right way. And the truth of it is that Western medicine is really a stepchild, an offshoot in a natural platform from the East. We wouldn't have what we have, particularly in my world, if that wasn't true. But again, thank you, my friend. I appreciate
Thank
it.
you so much.
And
thank you for having me. And I really hope that your listeners enjoy. I'd love to invite them to come and see us over here at VUIM or whichever campus they're nearby. And also just to remember to think of the whole spectrum when it comes to healthcare. And we always want to work on prevention so that your body can live the most optimal quality of life.
Ciao, baby. Thank you.
Thank you.
This was fun. These are the type of programs that I enjoy because I get to talk to people who really have their act together, if you will, and really understand what it is that the body needs to optimize itself and to really have the opportunity of ageless health. That's what we're designed to do. That's where we really have to begin to move forward to, because otherwise, like we went through over the last several years, we're going to be drugged, we're going to be set aside, we're going to be put down, we're going to be emotionalized. All of those things are not your birthright. This is your birthright to allow your body to do what it needs to do. Join us coming up, by the way, I think it's the 10th, this next Wednesday evening. Dr. Harlan Browning will be my co-host and presenter at the Roselle Center in Fairfax. We're going to be talking about degenerative arthritis and all those things that you can do to make a difference and turn it around and not have to live with it. Trust me, you can. I promise you that it's going to be eye-opening. So join us. You can reach out at drtomroselle.com and you can register for that class. Please do. We want you as our guest, but we'll have another great program for you next week and another guest. This is Dr. Tom Roselle. See you next time. I love you all.